I like characters that are flawed, that are trying, but who fall down and make mistakes. And I've always loved like a lot of sadness in my comedy, which did not make me a successful stand-up.
People in America are moved by anecdote, not necessarily by science.
In America, people learn everything through pop culture, and that content has a big responsibility to portray mental health, to portray addiction in responsible and accurate ways.
When we reduce stigma around mental health issues, addiction issues, eating disorder issues, what we do is we allow people out there in the real world who are struggling to feel like they are safe and secure to say, I need help. It is life-saving to open up this dialogue.
What are the realities of someone seeking treatment for addiction or for mental health? Like, what does it look like right now?
Right now, there's an overdose crisis where 70,000 people are dying every single year. And I think that there's a responsibility to not be quiet about that and to speak up.
People who overuse are really self-medicating. They usually have an underlying mental health issue. And so when we're talking about addiction and substance use, we have to talk about mental health in the same space. They're the same thing.
Over time, the connection to a substance creates both a structural and a chemical change that creates behavior outside of the norm and has someone, in a very pejorative sense, choosing a substance over life.
There are medications out there that save people's lives, and yet in media, we don't see people taking these medications.
If you have somebody in your life who has an opiate addiction, get some Narcan.
Narcan, or naloxone, puts them into florid withdrawal, but it keeps them from dying. And that's the important part, because I can never get somebody who's dead well.
There are going to be so many scenes with Narcan in these people's scripts. It's going to be great.
That's
it's going to be
good.
good.
That's very good.
On your show, you know, Allison Jennings' character is dealing with addiction herself and has a daughter dealing with it. So how did you find out about what recovery would look like and sort of where the challenges were for these characters?
A lot of times when recovery is portrayed, it felt like there was no joy and light. And I think that that is what we felt was missing. Recovery is not the end of the story. It is the beginning of the story.
If I could say one thing to writers, I'd say the biggest one is please stop portraying someone who's in recovery from addiction as having a weakness inherently. Treat them like they've overcome cancer, because this disease has the same mortality rate.
And thinking about this as writers, as we're coming up with character descriptions, finding the right words to use feels really important. If we use a word like addict that just like stops us dead, it's taken all the agency away from that character.
In a perfect world, we don't call them addicts, we call them a person with addiction.
We need to really think about the language we're using. If we call someone a drug addict, that elicits connotations about people being selfish and manipulative.
They're struggling inside, they're hurting inside, and that's why they're going to drugs, alcohol, other compulsive behaviors, because they're trying to help themselves feel better.
Depression hurts. It's not just an emotional, psychological pain, it is physical.
I would say that the science backs that up 100%, because the two chemicals responsible for depression are also really important chemicals in pain.
Our society as a whole has embraced talking more about mental illness in general and substance use disorder. And I would say, thank you to television and film actually for opening up a lot of that discourse. And the great thing is when we can see those stories in television and film, and we can see people having compassion, that gives our young kids that model to be like, oh, if somebody's struggling, I reach in and help.
Writers want to be responsible. They want to sort of reflect reality. Hollywood Health and Society is a great resource for writers to be able to reach out and say, what is the real science behind this? What is the best practice?
We've had them send 2 experts to us, and both of those experts helped us so much to get to the story we really wanted to tell the honest truth.
I have found that the writers have always been really open. They really want to get things right, and we're just working together to help end suffering for people everywhere.